this is Ndaishime Jean Baptista, and tonight I'm delighted to make a presentation on urology prerequisites. What do I mean with prerequisites? Prerequisites are meaning that it's something that you need to know and to have information about before diving into particular subject. So I'm going to be introducing to you something that I think that have helped me to understand and to feel comfortable with dealing with urology as far as I'm concerned. So the content of this urology prerequisite, which will be in 3 videos. The first videos I'm going to be talking about anatomy, but also there will be a video talking about significance and the preliminary investigation of urological signs and symptoms, and also mentioning and elaborating urological investigation. So let's get started with anatomy of urology. So as you can see on this screen, there is an image of structures that are concerned about in urology. You can see kidney, you can see renal pelvis behind these vessels, you can see ureter down to the part of urinary bladder. So why have I put this image? This image is to show you the structures that are being dealt with urologists, but not only for showing these structures, but also for the purpose of elaborating some points, especially on ureter. The thing that I would like to mention this ureter on this image about ureter, look at its blood supply. We have a proximal part of ureter, we have middle part, and you have distal part of it. You can see that the blood supply of proximal part of ureter comes from renal artery. The blood supply of middle part comes from gonadal arteries, which may be testicular artery or ovarian artery, and also we have a blood supply from common iliac vessels. Then the distal part of it have a blood supply from mainly internal iliac arteries. So this is the image, and as we go through the urological courses, so urology courses, you have to be recalling this image and try to understand the significance of it. And here you can also notice some of the narrowest parts of ureter that most of the time we may show. Here it is. Here it is at level of utero-pelvic junction. Here it is at the level of pelvic brim, or where it crosses the common iliac vessels, and at the entry into urinary bladder. So these are parts which are most concerned, especially in ureteric stones, which are more likely to be affected by stacking of the stone in those narrowest parts. So here we see the water under the bridge at this level, and they are down. When you move down at the level of uterus, we see water under the bridge where uterine artery cross over ureter. So the next image is the image which showed dissection of kidney. Why this image? I want you to get something from this image, especially when we are discussing and talking about renal injuries. You have to notice that there is a capsule, renal capsule, which is here. There is also cortex, renal cortex. There is the renal medulla. There is minor caryces, major caryces, and renal pelvis. So as we be going through throughout the topic related to renal injury, stone formation, hydronephrosis, distortion of structure in the hydronephrosis, you have to be recalling this anatomy, because look how this renal papilla looks like in a normal kidney, but in severe hydronephrosis you will be seeing that there is a distortion. You can see that here renal capilla is convex, but when there is severe hydronephrosis, it is going to be concave. It is going to be carved out, while at this point is carved in. This is something that I want you to recognize. And also when we say that staghorn cariculi take shape of caryces, mainly staghorn cariculi comes because of bacteria. So they take shape of these minor major caryces as they get brushed into these minor and the major caryces. So another image. This image, as you can see, it's demonstrating lymphatic drainage of different parts. You can see the lymphatic drainage from kidney, lymphatic drainage from ureter, lymphatic drainage from urinary bladder, and many of them. So you can see the lymphatic drainage from kidney mainly comes here around inferior vena cava, around abdominal aorta. So as far as we will be talking about malignancy that affect kidney, you have to be recalling the lymphatic drainage of it. Lymphatic drainage of ureter. As we get to the point of demonstrating and talking about ureter, carcinoma of ureter, you have to understand where is the first lymph node need to be checked, need to be examined on this particular point that I'm suspecting the carcinoma of ureter. So here it is urinary bladder. You can see the lymphatic drainage comes here around internal iliac, external iliac, and as well as common iliac. So these are the parts which need to be evaluated when we are talking about cancer, carcinoma, malignant tumors of these particular organs. Okay, this is the same image also which which elaborates more about the lymphatic drainage from urological organ as well as other some organs. You can see kidney comes here around the inferior vena cava, aorta. You can see testis, very important. It comes here around inferior vena cava and abdominal aorta. You can see bladder, urinary bladder, comes here around common iliac vessels. Common iliac vessels, lymphatic drainage of urinary bladder. You can see here they are demonstrating lymphatic drainage of uterus and the upper part of the vagina, which comes here around internal iliac vessels, and here at the level of common iliac vessels. So this is something that need to be perceived and being clear in our mind when, especially when we are talking about malignancies. As far as we can talk about adrenal gland, you can see some part, inferior part of the adrenal gland drain here around inferior vena cava and the aorta, but the superior part drains there up even to the point of the thorax. So it's not surprising to see tumor of adrenal gland moving up to the thorax as a first metastatic region. So here is another image of urinary bladder. Why this image? This image is showing urinary bladder with its detrusor muscles, but it is also showing its relationship to ureter, vas deferens, and seminovesicles and prostate, as well as pelvic diaphragm. What does it tell us? There is classification of urinary bladder carcinoma, transitional cell carcinoma, and there is a staging of it, and we stage or we classify it into different types depending on the level of invasion. We may say it is confirmed in the urinary bladder, it has invaded the surrounding structure like seminovesicles, vas deferens, prostate, and it has get far away into the pelvic diaphragm. So as we talk about urinary bladder carcinoma or malignant tumors, try to remember its relationship with other surrounding structures, and as they talk seminovesicles, as they talk prostate, as they talk pelvic diaphragm, understand the severity or how far the tumor might have disseminated. And remember, this is the posterior view of the urinary bladder. So here it is showing the zones of prostate gland. We have almost 5 zones, 4 zones and ureter. We have peripheral zone, we have central zone, we have transitional zone, and fibromuscular zone, and also ureter. So what is the significance of this? When we talk about prostate gland, the most things that comes into our mind, it is BPH, benign prostatic hyperplasia, as well as carcinoma of prostate gland. And we know BPH is more likely to affect transitional zone. As it affects transitional zone, the more it is close to urethra, the more it may lead to lower urinary tract symptoms that we found in a patient with BPH compared to someone who has carcinoma of prostate, where the tumor is confirmed into peripheral zone. So this is something that you need to be remembering, that you need to recall. Recall peripheral zone, recall central zone, recall transitional zone, recall fibromuscular stroma, and also urethra. So other thing that I would like to mention on this image, on digital rectal exam, you can see that here there is sulcus which separate right and left lobe of prostate gland. They say during physical exam, in a person with normal prostate, you have to be able to palpate these sulcus. But in someone with tumor or cancer of prostate gland. These sulcus that we are seeing here get distorted so that you could not palpate that sulcus, which is also the important of doing physical exam. So here is testis. Testis itself, we saw its lymphatic drainage, but I would like to mention about other structures which are in the vicinity or the surrounding area of testis. Epididymis, ductus deferens. We have to understand when we say epididymosis, and we understand where it is located. When we say ductus, we understand where it is located. And when we say testis with its seminiferous tubules divided into lobules, together with tunica albuginea, which is the surrounding structure of testis, to understand what it means, what it is telling us, and to understand the anatomical structures of these particular organs. So here is the image of urinary bladder again, but I put this image here for the purpose of making you to remember micturition process, or the effect of parasympathetic and sympathetic nervous system, autonomic nervous system on urinary bladder. As you can see on this image, urinary bladder have receptors for parasympathetic and sympathetic. Parasympathetic stimulate M3 receptors, which are located on the trusor muscles of urinary bladder. As they stimulate, means they cause or they lead to transmission of impulse in those detrusor muscles. As those detrusor muscles get stimulated, they are ready to contract and to push urine through urethra. But for sympathetic, you can see that they inhibit. They have a receptor on urinary bladder, which is there to inhibit contraction of the trusor muscles. But again, it have a receptor on internal urethral sphincter, which stimulate them to contract, to close. So as to prevent urinary bladder to contract and make internal urethral sphincter to close, means it leads to inhibition of micturition. This is the impact of parasympathetic and sympathetic on urinary system. Please recall, let's say something's threatening you, or something that threaten you may cause you to forget about the need for micturition. So means something which stimulates sympathetic made you to forget, made you to have a relaxed urinary bladder muscles, so that you could not go to toilet to pee. This is something that needs to be remembered. When something threaten you, surprise you, you may forget to go to urinate. So that's something to be noted. Again, this image, I'm trying to mention some of lymphatic drainage of penis and scrotum, which is different from the lymphatic drainage of testicles that we saw. You can see that the main lymphatic drainage of penis and scrotum, it is right here at inguinal lymph node, deep inguinal lymph node and superficial inguinal lymph nodes, which show that there is a difference between malignancy of scrotum and malignancy of testicles. So as far as we are concerned about management, you have to be careful about different approach that you may have on tumors that are confirmed in the testicles and tumors that are confirmed on scrotum or penis, in physical exam and in the management, surgical management as well. So here comes the branches of nervous system or nerves that supply these pelvic organs. You can see there are a lot, they're huge, sympathetic, many. There is the intention of this image was to show how these pelvic organs are really like that. Look, the nerves, the nerves that come from rectum, it comes also to urinary bladder. That means it is not surprising to have rectal GI problems when the actual problem is confirmed in urinary bladder. So this is where you will have the combination of lower urinary tract symptoms and also the symptom of genital gastrointestinal system. So pay attention on these now. Nervous systems apply to these pelvic organs. So this is the same thing. You can see the nerves which are here around ureter. Let's say we know that they say someone may have ureteric stone, but the pain is referred in the scrotum. Look, here we have this nerve, and here we have another one. So if there is irritation or migrating stone in ureter, which is located here, and ureter get inflamed, it's not surprising also to inflame these nerves, which moves down here on the thigh, moves down here on the scrotum. So pain of upper ureteric stones may radiate into scrotum. That's the meaning of this image as far as I'm concerned. So guys, this was about anatomy. I hope that you have been trying to capture some more information that was elaborated in this image. So next video we'll be talking about symptoms and signs of urological problems, so and their significance in the future materials or future classification or future presentation. So I hope this video you found it helpful. So keep subscribing and liking and sharing the comment, and even you can send me even on the email which is shown in the video. So please keep sharing, keep giving me feedback of what I could improve and what I could work on more videos. So I thank you so much.